My name's McKenna, and I chose to do my Tech 380 presentation on cloning and robotic assisted surgery. So to start out, I'm going to go over a few key things that I found from the text on cloning. So the definition of cloning is the creation of a living organism from the cell of a single parent. It is accepted as a technology for farmers, but not yet for humans. And Dolly, which is a picture of the sheep to the right, is the first animal that was ever created, or first clone that was ever created in 1996 in Scotland. A fun fact is that Dolly was actually the 266th trial from the same DNA of a sheep. Moving forward to my article, I want to make it known that I am for using cloning for animal purposes, but not for human purposes. So from the article, I found some pros and cons. Some pros are if a husband cannot produce sperm, they can make a child from his DNA and a mother's egg. I find this as a great pro because a lot of parents are wanting to have children, but sometimes their bodies will not allow it. Another thing is that if children can be cloned to not have genetic diseases. This is a great thing that cloning can help because if you are a parent that you know that you have a genetic disease that you can pass on to your children, you can actually make it so that you know that your child will not have this disease. Also, beloved pets can be cloned to replace deceased animals. This is not one of the greatest things that I thought of while going through this article. I actually think it would be a little bit creepy to have an animal that was cloned, and I would never be able to replace a beloved animal like that. Some cons I have found from the article were that cloning could lead to birth defects or premature aging. So because cloning is so new with humans, it's people are very unaware of what could happen during the pregnancy, and this could lead to issues during birth or with the parents. Another con could be that clones could have a difficult time being independent. So if you think that if you were a clone of, or if I was a clone of my mother, would I feel like I needed to be exactly like her? Would I feel like I needed to follow in the same exact footsteps as her and act the same way as her? That's going to cause problems if multiple people are having clones as children, that there's not a lot of diversity. It takes many attempts to get cloning correct. Only about 3% of cloned eggs will not end in miscarriage. This could be really upsetting on many different platforms with the mother that is trying to have a clone as a child. Only 3 out of 100 of these children will actually not end in miscarriage. This could cause depression and for the parents to actually feel like they aren't going to be able to have this child. So moving on to robot-assisted surgery, I was actually really excited to have this because my father actually just recently had surgery and it was also robot-assisted. So some great things that I found from the text were that robots have more precise movements than the human hand. These surgeries can be performed remotely, meaning that they can be performed from different states if the person was not able to actually make it to the hospital that their that their surgeon works at. Also, lag times can lead to serious problems, which I'll go more into on the next slide. So from the article, I found a few pros and cons. So some pros are there's less chance of redo surgery. From the article, there was about 200 non-robot assisted surgeries performed and robot assisted surgeries performed, and this led to less people, the robot assisted surgery led to less people having to come in to get their surgery redone or get something else fixed. It's also easier to manage excess bleeding during surgery. With the robot, with humans, they could get kind of scared, or not scared, but get flustered when excessive bleeding starts occurring. And having the robot-assisted surgery actually helps because they're able to suck up the blood and get the thing fixed, the cut or whatever is happening fixed faster. One of the biggest issues, or one of the problems that a lot of patients have with surgery is that they're worried about how big the scar is or where it's going to be. One great thing with robot-assisted surgery is that usually the tools that are used from the robot are smaller, which leads to smaller scars. It's also easier to perform these surgeries on small children or infants because, again, the equipment that they use is much smaller than it is from a human hand. Some cons like I talked about before, if the video lags, it could cause serious problems. So if you're remotely doing a surgery, you actually get a video feed of what you're doing in live time. But if the video starts to lag at all, it could lead to serious problems because you could think that you're doing something and then it's not working and you just keep pressing and pressing. So if you were cutting something, you didn't see that it was cutting and you kept cutting, it could cause some serious bleeding, some serious problems. Also, possible malfunctions could occur in technology. All technology is subject to malfunction. So there is always other people in the room, even if it is being done remotely or a expert on the robot, but it's not always going to be able to help if there's a malfunction. Also, it's more expensive if remotely done because you actually have to pay 2 physicians because one has to be in the room in case the technology malfunctions, and you also have to pay the one that is remotely doing your surgery. Overall, I think robot-assisted surgery is a great idea, and I think that it could really help with surgeries in the future. And this is my reference page. Thank you so much for listening. I hope you